Good afternoon. I'm Dr. Smedal Kort. I'm the director of the Valve Center and the director of non-invasive cardiac imaging at Stony Brook University Heart Institute. And I'm here with my friend and colleague, Dr. Noel Mann, who is the co-director of the Women's Heart Center at Stony Brook Heart Institute.
Hello, everyone. I'm really happy to be here with my colleague for 15 years, Dr. Kort, on Go Red for Women Day. And Go Red for Women is really all about the movement to end heart disease and stroke in women and create awareness of heart disease in women. And, you know, unfortunately, it's always been thought of as a man's problem. But as hopefully you'll learn by the end of this, that it's actually the leading cause of death in women as well, in men and women, but and it's responsible for 1/3 of the deaths in women, and that's more than the next 7 causes combined. So it's very important to learn your risk factors and be aware of them, and mainly because much of heart disease is preventable.
The cardiology community had done a great job improving heart attack survival for both men and women. However, death rates from heart disease among women still outpace death rates in men, according to the American Heart Association. Yet heart disease is still regarded, just like Dr. Mann said, disease of men. And this lack of awareness is putting women's lives at risk and lowering their chances of survival. Heart Month, which is what we celebrate in February, is the perfect time to raise awareness and educate both women and men on the risks and symptoms of heart disease and how to prevent them. I'm sure many of you have heard of Go Red. It actually stands for GET, that's the G, get your numbers, own your lifestyle, realize your risk, educate your family, and importantly, don't be silent. And that's what we're here to talk about today.
Great. So I guess we'll start, I think, with some questions. Is that correct?
Yes. So, Dr. Mann, we talk about differences between men and women. So, how do women's hearts differ from men's?
So one difference in men and women is presentation of heart attacks. Many women will have the same presentation as men with heart, with chest pain, shortness of breath, but women have different symptoms, and we'll go into that a little bit later. Plaque buildup is different. Women are more susceptible to the risk factors of coronary artery disease and heart disease than men. And women, unfortunately, don't still have worse outcomes than men, and there's a lack of awareness in women.
You mentioned plaque before. So one of the most common types of heart disease is ischemic heart disease, also known as coronary artery disease. It happens when the coronary arteries, which are the blood vessels that supply blood and oxygen to the heart muscle, become narrowed by accumulation of plaque. That's the plaque that you talked about before. And this plaque can rupture and lead to significant reduction in blood flow, which can cause a heart attack. Although this process can occur both in men and in women, there are some differences between these genders. And maybe you can tell us a little bit more about the differences between them.
Right. Women tend to, on average, have smaller blood vessels than men. And women also tend to be more susceptible to the kind of vasoconstrictive properties of the blood vessels. So they tend to
narrowing.
Yeah, well, it's more of the spasm of the blood vessels in women than men, although it can occur in men, but women tend to be more susceptible to that. They also tend to have higher risk of ischemic heart disease with diabetes as well as hypertension. So their effect of those risk factors is more potent in women than it is in men. And the same goes with smoking, obesity, diabetes, hypertension. So all of those things are very important to manage with your physician.
The way men and women experience the heart attack is also different. Tell us about that.
Yes, definitely different. I always tell my trainees, my fellows, I always recall this patient that the only pain that she had during her heart attack was a pain in her armpit, but chest pain, obviously, pressure, cold sweat, shortness of breath are common in men and women. But women can also have very subtle symptoms like fatigue, back pain, jaw pain, just feeling dizzy or lightheaded. Nausea and vomiting is also something to look out for, and an overall sense of dread. And, you know, we've had many patients tell us they just don't feel right, and that's why they came in. And they can also develop slowly. They can go on for a few days at a time. They may not be quite so dramatic as they are sometimes in men. The other things you need to look out for is pain that radiates to your arm, radiates up to your jaw. So those are the, you know, the main symptoms, but women can definitely have more subtle symptoms than men. And
So Loris, I'm sorry, go ahead.
I'm sorry, if you do have any of these symptoms, it's really important to call 911 and not drive yourself to the hospital, because there are bad things that can happen on the way to the hospital, like arrhythmias, and other issues that can happen on the way to the hospital. It's important to take the ambulance to the hospital if you should have any of these symptoms.
So yes, we always do tell people to seek medical attention if they think that they may be experiencing a heart attack. But women are less likely to get help than men, partly because the symptoms, just like what you described, may not make them think that they are coming from their hearts. But regardless of the gender, if you're having a heart event, you want to be evaluated right away in a place that can provide quick and efficient diagnosis, followed by prompt intervention and treatment. Our Heart Institute has the Long Island's only chest pain center, which is a dedicated center accredited for both primary PCI and resuscitation. And PCI stands for the percutaneous intervention, which is done to open a blockage in the blood vessel. The key is getting patients treated as quickly as possible, so less heart muscle is damaged. Therefore, educating the community, which is what we're trying to do now, to recognize possible heart attack symptoms and then take a quick action is really so very critical. And that's especially true for those who have risk factors for developing heart disease. So Dr. Mann, what are some of the risk factors for heart disease in women?
So there's what we call the modifiable and unmodifiable. So unmodifiable is your family history of coronary disease. Does someone have a heart attack at a young age? Less than 45 in men, less than 55 in women. And your age, you can't unfortunately do anything about that yet. And then our modifiable risk factors, which is high blood pressure, diabetes, obesity, sedentary lifestyle, smoking, and all of these risk factors affect women more, especially smoking. It's for any of the women that are watching this out there, if you smoke, please make every effort to stop. Women that smoke on average live 14 years less than women that don't smoke. That's not just from heart disease, from all of the other damage that smoking does. So it really has a terrible effect on your body. High blood pressure is a stronger risk factor. Diabetes. There's obviously obesity increases your risk for heart disease. And sedentary lifestyle. Many of us think that exercising is good, which it is, but actually not exercising is bad. And not exercising has a similar risk for heart disease than actually close to smoking a pack a day. So for all people out there that say, well, I do everything else right, but I don't exercise, not exercising is a big risk for heart disease. So, if you're not symptomatic, then try and, get out there and start to move. And the recommendation is 30 minutes most days of the week. the goal of at least 5 days a week, at least 30 minutes. There's also some other risk factors. Depression. Patients that have depression have a 2 times higher risk of ischemic heart disease. Early menopause, menopause before the age of 45, puts you at increased risk for heart disease, ischemic heart disease. Having had gestational diabetes, and also preeclampsia during your pregnancy. So all very important to look out for those risk factors and manage them aggressively.
The G in Go Red stands for Get Your Numbers. So what are some of those key numbers that people should be aware of in order to improve their heart health?
So you want to maintain a blood pressure less than 130/80. A BMI, that's your weight, less than 25 is considered normal. 25 to 29 is overweight, above 30 is obese. There's many BMI calculators out there. You just put in your height and weight and that will calculate that for you. Your diabetes, a fasting blood sugar less than 100. If there's any doubt that you might have diabetes, there's something that your doctor can check called the hemoglobin A1C, which tells you what your sugars are doing over time. And ideally, we'd like for this to be less than 6.5 or less. Let's see what else. But those are sort of the main numbers. Your cholesterol, it's a big one. Depending on your risk factors and your age, there is a calculator that we use that we kind of plug in your age, your blood pressure, your cholesterol numbers, and then that makes a recommendation to us of whether you should be on a cholesterol lowering medication or just continue with diet and exercise. But in general, we would like your bad cholesterol, which is your LDL, to be less than 100 would be ideal. Your HDL, which is your good cholesterol, which is the protective cholesterol, above 55 is considered a negative risk factor. So that's, we would like that. HDL is a little tougher to kind of move around. The only thing that's really been shown to raise your HDL is exercise, but that's a little bit of a tougher number to move around. But your LDL, you can definitely modify with your diet, and that's avoiding foods with saturated fats, so fried foods, highly marbled meats, processed foods, and obviously eating more fruits and vegetables.
How about some red wine? Is that good for your heart?
So 1 to 2 glasses of wine a day is safe. More than 2 isn't for women. So in general, I think if you don't drink, I don't think you need to start drinking, but it is safe to have 1 glass of wine a day.
So in moderation,
yes.
Red wine and dark chocolate. So in addition to knowing your risk factors, and thank you, Dr. Mann, for really going over all those risk factors, but in addition to knowing them and really trying to modifying them by following a healthy lifestyle, it is important to work with your primary care physician or cardiologist. They may prescribe you some medications to further reduce your risk, and they may order some imaging studies that would help them better assess your risk and guide your therapy. Stony Brook Heart Institute offers essentially every possible imaging test that can provide valuable information about the heart, including echocardiograms, which are ultrasound of the heart, coronary calcium score, ultrasound to evaluate the thickness of the blood vessels supplying blood to the brain, PET scan, cardiac MRI, and both nuclear and echo stress tests. Our echo department is the only one in Suffolk County that is accredited in all types of echo tests, and one in only 7 on Long Island and 40 in the entire state of New York to hold such accreditation. Because we can offer every possible imaging study, we tailor and personalize our care to the individual patient and perform the most appropriate study in order to minimize risk and obtain the most information. For women, especially for young women, Our goal is to minimize radiation to the chest, and we have different protocols and solutions to do that. So how does women's health or heart health changes at different ages? And what should we be doing to maximize our heart health at different ages?
So I think, when you're less than 40, we'll start, well, actually, we can start with pregnancy and heart disease to help those women that have either preeclampsia and hypertension during pregnancy or diabetes during pregnancy. But if you have preeclampsia and hypertension in pregnancy, it puts you at risk for ischemic heart disease later in life. And you really want to be aware of that at that young age to look out for that. Knowing you have hypertension in pregnancy means you really have to monitor your blood pressure. And the only way to find out what your blood pressure is for someone to put a blood pressure cuff on your arm. So it's not that you're going to feel if your blood pressure is high. Some people may if it's very high, but if it's in the 150s, 160s, you may not feel anything. So it's very important to follow up with your physician on a regular basis, have your blood pressure checked. And especially, in those that have that. When you're under 40 or even in your 30s, it's important to really modify your risk factors and, or not modify, but at least control your risk factors as much as you can. We've seen from studies of troops that were killed in battle that the process of atherosclerosis starts at age less than 20. So those little fatty streaks that start to show up in your arteries start at that young an age. So it's really important. I kind of see it as pennies in a piggy bank. Every time you exercise, every time you eat your vegetables, every time you, go to the doctor and make sure all of your risk factors are controlled. That's kind of money in the piggy bank. Every time you put a cigarette or smoke a cigarette, you're taking money out of the piggy bank. So really important to develop those lifelong habits of exercise, eating a healthy diet with plenty of fruits and vegetables, staying away from sugary drinks, also trying to stay away from drugs and alcohol. If you smoke, stop smoking, please. Really that's one of the biggest ones. Also e-cigarettes. We don't have, unfortunately, a lot of data on the long-term side effects of e-cigarettes, but so far in some data that we do have, they've been shown to increase the risk of heart attack by 2 times. So they appear to be very dangerous. So whatever you can do to stop smoking. And there's many tools out there also to help you stop smoking. There's the patch, there's gum. Some people like lozenges because it's something in their mouth. And there are medications that can be prescribed to help you quit. When you get a little bit older in your 40s, above your 40s, again, you want to make sure that you go to your physician, that your cholesterol is checked, that they use that risk calculator to determine what your risk is for coronary disease. And if you need medication to control your cholesterol, then it's important to take that. Make sure that you exercise. And another thing that I don't think is emphasized enough is to do some resistance and weight training. After age 40, if you only do cardiovascular exercise, you actually lose muscle tone. So it's really important after age 40 to do some form of resistance training in addition to cardio. This is, just more to keep yourself in balance and healthy. And the other thing is to control your stress.
On your heart. And it's never too late to start exercising.
Right. And resistance training, it doesn't mean you have to, turn into Arnold Schwarzenegger. It can be yoga, Tai Chi, body weight exercises like push-ups and sit-ups. Nothing, too terrible. And again, menopause, after menopause, it's very important because obviously heart disease goes up significantly in women after menopause, to take care of those habits and to make sure that you control everything that you can control. And, you know, we have a team here at our Women's Heart Center that's here to treat women and to evaluate women with cardiovascular disease. And we have all the facilities here as well to treat women for any condition that they have. I guess one other thing to mention is hormone replacement therapy. So there is a lot of controversy about it. The initial studies on hormone replacement therapy were done in, unfortunately, the average age of the women in that study that kind of put the kibosh on it was 63 years of age, which is well past when you have menopause. There are some other studies that have shown that hormone replacement therapy may have some effects, although the studies were not necessarily done for that. But there are some limited data that there may be some benefit, although it's only indicated in women if they have significant symptoms of menopause or osteoporosis.
This is why it's so important to be seen by someone like you, who is part of and directing our women's health. So you work together with other physicians, and together you can make the best plan for that particular patient. So, Dr. Mann, what do you feel is the most important thing for women and those in their lives to know?
I think, you know, one of the most important thing is to be your own advocate. If you feel something that doesn't feel right, seek medical attention. You know, one thing I kind of failed to mention before that I meant to mention is stress in your life. It's important to be able, if you have a lot of stress in your life, to try and minimize it as much as you can. Obviously, during these difficult times, it's hard to minimize it completely. But whatever you can do to minimize that stress is important. Seek help from other people. Meditation, yoga is helpful in, you know, in dealing with that as well.
Help is available online these days via Zoom or otherwise online or via phone calls.
Oh, yes, definitely. I mean, I think even if you can't go to a live class, going through Zoom is better than nothing. But again, if you don't feel that something feels right, just seek medical attention. If it turns out to be nothing, then great. But it's the important thing, especially with the heart, is that if you delay, you can cause permanent damage to the heart muscle, and that can be irreversible if you delay too much. So as we say in cardiology, time is myocardium, which means time is heart muscle.
So my last question to you, what do people need to know to ensure they're receiving the best cardiovascular care?
So I think, you know, everyone, regardless of their age or medical history, should go to their primary care doctors, stay, you know, be up to date with their cardiovascular screenings, know your cholesterol numbers, know your diabetes numbers, check your blood pressure. If you're able to afford it, buy your own blood pressure machine and have that, you know, verified at your doctor's office. You know, be aware of the signs and symptoms of heart disease. And if you have any of those, bring them to your doctor's attention. But I think that's you know, really the most important thing. Don't ignore it. Pay attention to your symptoms. You know your body the best than anybody else. So if something doesn't feel right, make sure you get that checked out.
Thank you, Dr. Mann, and thank you everyone for joining us today. We hope that our conversation helped you better understand the importance of putting your heart health first. And if you don't already do it, the time to start is now, it's today. And if you're not sure where to start, ask your healthcare provider about a heart health screening that would be tailored to your age, to your overall health, and to your risk factors. We want you to know and remember that our team at the Stony Brook Heart Institute is here for you, whether you are looking to prevent heart disease or you already have one. Happy and healthy Heart Month.